Hello everybody and welcome to the Tuesday edition of Video Clips. And as you can tell, I'm not in my office, which is usually where I film these. And the reason is because we had a furniture malfunction. Easiest way to put it. A piece of furniture fell apart and they just finished rebuilding it, and my office is not very well put together. It wouldn't make a very good impression. So I'm in another room in the office talking to you from here. So first of all, a couple things. I am in the middle of the diabetes course right now, diet, lifestyle, and diabetes, and we're filming as we go. So if you've missed the first couple of lectures, you can pick those up on the video platform and then join in for class 3 and 4, and you can watch all of it on the video shortly. I think the fourth class is next week or the week after, and then you can watch all of those videos online. The next live course after that is time management, and then cognitive health and Alzheimer's disease, your amazing microbiome and health benefits of cannabis, and IBS is the last one. So all of these classes will be taught live, and then we film as we go, and you can watch them on the video platform too, with assignments and that sort of thing. Let's see, the medical medium, which was a very well-attended class, we had to stop early and reschedule it, and the reason is because somebody started snoring about 45 minutes in. I'm not kidding, this really happened, and the snoring became louder and so distracting. Then we had to end the class and reschedule it. So the medical medium part 1 is now scheduled for tonight, and then the part 2 will be in July. So for those of you who want to participate in the discussion, get in touch with the office right away, 614-841-7700, and join us. And all those advanced study book discussions, those all get put on video platform too. So you can actually now go online if you're a subscriber and have access to the 100, I think there are 120 or so videos based on the books that we've discussed over all these last several years. And then the next Food Over Medicine coaching program starts after the 4th of July. So if you would like to open a Food Over Medicine chapter, we have some wonderful package opportunities where you can sign up for some educational courses with the coaching program. So anyway, pampopper@msn.com, and keep those career inquiries coming too. Those of you who think that you'd like to be helping others, I'm anxious to talk to you. All right, as usual, I want to start with a couple of comments on that have been left on the channel that I think would be interesting for everybody to have a little more discussion about. And again, I continue to get a lot of comments about the mammography video clip, and I think it's because the whole issue is just so disturbing to women. And one comment that I've got a lot of times, some version of this, well, my gosh, if mammography doesn't work, and thermography doesn't work, and by the way, thermography doesn't work because the shortcut, we have two big problems with thermography. One is that to the extent that the problem with mammography is that it detects small, insignificant things that you'd be better off not knowing about, thermography detects smaller, more insignificant things that you'd be better off not knowing about. And the radiologists who are reading those thermograms are even more unreliable than the radiologists reading mammograms. So there is no evidence that shows that either a mammogram or a thermogram reduces your risk of dying of breast cancer. Okay, so some of you, some women in our subscriber base, I understand this, are really disturbed because the sense I'm getting is I'm looking for some assurance that I don't have breast cancer, and now you're telling me that what I thought was the assurance that would tell me I don't have breast cancer doesn't tell me that, and now what am I supposed to do? And I totally get the angst associated with this because we have all been taught, and I used to believe this too, people, that if we have a mammogram and all these screening tests and that sort of thing, this is how you know you're healthy, and you can breathe a sigh of relief and go on and live the next year or 5 years or whatever the interval is before you get tested again, and not have to worry about it. And there just is no such assurance for anything other than cervical cancer. I think we do a pretty good job of early detection there, but even that's abused. So here's the way that I explain health to people. Those of you who listen to me a lot know I teach by analogy, and so I'll do that here. There is no guarantee, and there's nothing you can do that would prevent you, 100% prevention program, from being in a car accident. There is no guarantee, right? So here's how I deal with driving, all right? Because if I got up every day and thought about, oh my gosh, there could be an accident, I could be in an accident, something bad could happen, you would become immobilized and not leave the house. So here's what I do. I keep my car in good working order. I make sure the brakes work and the turn signals work and all that kind of stuff, okay? I fasten my seatbelt and I drive the speed limit almost all the time. I mean, I've caught myself a couple times going too fast, I think we all do, but I pretty much follow the speed limits. And I stop at the stop signs and I watch for kids in my neighborhood and distractions and all that sort of thing. But here's the bottom line: no matter how careful I am about driving, the reality is that I could get in the car to go home tonight and get hit by a bus. And that's the reality. Now, if I spend all my time thinking about getting hit by the bus, I'm going to become immobilized. Life is no longer enjoyable. And I'm going to stop living. I mean, what's the answer to that? I'll just never drive. Well, that's ridiculous, right? So I would encourage you to pay attention to your health the way you pay attention to driving a car. No guarantees as to outcomes, but you do the best you can. I mean, the best I can do in terms of driving is to have a car in good working order and be careful and follow the speed limits and stuff. And beyond that, there's nothing I can do. So I just have to put it out of my head. That's what you do with your health. The other thing, and this really touched my heart, was a person who left a message on the comment section who said that in response to some of the videos about psychiatric drugs, that his life had been ruined by people who prescribe these psychiatric drugs. And that's just horrible, and I hate to hear it. What I would say in response is, don't let your life be ruined. Don't allow that to happen. There are things to do. There's therapy, there's counseling, there's getting your body in better shape. There are so many things that can be done to help you recover from this. So don't give up. Please don't give up. No matter how sick people are, no matter how much they may have been abused by the medical system. And by the way, the usual caveat, there are wonderful doctors out there. I'm not talking to you, I'm talking to the irresponsible, overdiagnosing, overprescribing, disease-mongering doctors. But no matter what any of these people did to you, you can have a better future. And the mere fact that you're watching this channel and you can make a comment about it, you're alive, celebrate that. And we offer programs that can help people like you. And so do other places too. So please seek help so that you can live a full, spectacular life in spite of the fact that bad things have been done to you, okay? So I always complain about things. I always have lots of criticism every week, as you know, so you're going to be surprised. I'm going to tell you a lot of good news right now. So research shows that patients who receive medically tailored meals, or MTMs, enjoy better health, and they have lower healthcare costs as a result. The authors of an article that reports a study about this state that following an appropriate diet is a cornerstone of maintaining health and managing illness. Well, this is true. However, as the authors note, there are so many barriers to eating well, which include things like food insecurity and disability that can prevent people from shopping for and preparing food and lack of time. Now, they didn't mention this, and I'm going to mention it because I think it's important, and that is that a lot of people just don't know what constitutes a healthy diet. People who aren't sick have trouble figuring this out, let alone people who are sick and are looking for an opportunity to use food as medicine. Well, I'll tell you a little bit about this study. We can't deal with the confusion part. We can. That's what we do here at Wellness Forum. But I'm really encouraged by this particular study. So how they arranged it is clinicians referred patients who had serious conditions like HIV and cancer and end-stage renal disease or congestive heart failure to an MTM program. And in addition to having serious illnesses, the patients shared some other common demographics and social barriers such as poverty or food insecurity. And then these people were matched with controls who had similar demographics and illnesses and similar pre-intervention healthcare utilization. Each week, the people who were in the MTM group received 10 meals tailored to their specific medical conditions for an average of 9 months. A total of 499 MTM recipients and 521 non-recipients were included in the study. Now, here's where it gets really interesting. Compared with the non-recipients, those who were given meals had about 49% fewer inpatient admissions and 72% fewer skilled nursing facility admissions during a 2-year period of follow-up. Those are big reductions. But here's what really amazed me. Savings were approximately $753 per person per month, or $18,072 per person for the 2-year period. Now, I think that the total number really will blow your mind. So if you do some multiplication, what you come up with is that in a 2-year period, the healthcare system has saved $9,017,928 in 2 years, all right, for these people getting meals. I'm sure that the meals didn't cost anywhere near $9 million. This was a tremendous return on investment. The other thing I'll point out is it's a fair assumption that the meals were better than what these people were doing before, but probably not optimal. So more optimal meals might lead to more savings, but we have to celebrate this. I mean, this is really phenomenal. An invited commentary that was in the same journal issue was titled "Food is Medicine: The Promise and Challenges of Integrating Food and Nutrition into Healthcare." And the authors in this commentary state that, quote, "Diet-related diseases produce crushing health and economic burdens." No kidding. They write that the cost of obesity-related conditions is $1.72 trillion per year, or 9.3% of the gross national product of the United States of America. I mean, it just boggles your mind. They go on to write, quote, "MTMs may represent the tip of the spear for a national evolution toward such food is medicine approaches." I mean, do you know how much that makes my heart sing to hear medical professionals publishing articles in medical journals talking about food is medicine? This is what I've been working for 25 years, is to get to the place where we're all talking about this. The authors of the intervention study note that Medicaid programs in several states have already piloted similar programs with similar successes, and that changes have been made to Medicare Advantage to allow coverage for some meal delivery programs. They state that more MTM programs will be needed in the future in order to more efficiently use very limited healthcare resources. Well, this is an incredible step in the right direction of recognizing diet as a primary intervention strategy. The fact that meals are reimbursable in some plans and has been shown to improve outcomes and save money makes me cautiously optimistic that this approach can become more mainstream. So, like I said, I'm always the bad news girl telling you awful things that are happening. This is a really wonderful development. And of course, many of you who've been listening to me for a long time or have read my book already know that food really can be medicine. This really works. But when you see something like this going on a community-wide basis, we should just all be really celebrating and high-fiving it right now. More of this, less medicine, more deprescribing, and more food is medicine. All right, that's all for today. As usual, pass this on to anybody you think would enjoy watching it, and also make sure that you hit the subscribe button if you're not a subscriber so you can get my videos every Tuesdays and Thursdays, and I will indeed be back to you on Thursday with more news.